Hi, we are third year nursing students at UCI, and this is our IHSS Caregiver Education Project on how to prevent the flu. My name is Janelle.
Hi, I'm Andrew.
Hello, I'm Chad.
My name is Zara. So this is just a general outline of what our presentation is going to be about. We're going to talk about what influenza is, the risk factors and symptoms, how to care for mild symptoms, and what happens in severe cases, as well as the nursing care aspect. So what is influenza? Influenza is a highly contagious airborne disease that manifests as an acute illness with a range of systemic symptoms. It is one of the most common diseases in the world, and it occurs in seasonal epidemics. I'll pass it over to Andrew now.
Thank you, Zara. So this graph that we're looking at is a influenza positive test reported to the CDC between October 3rd and February 12th. The CDC is always doing flu surveillance and releasing weekly reports of positive tests that are reported to them. Here you can see that there was a small increase and then a decrease. And in recent years, most flu positive cases reported have been decreasing because of the COVID-19 precautions, such as wearing your mask or washing your hands. Pass it back to you, Zara.
Thank you, Andrew. So this is just talking about the transmission of influenza. It's a highly contagious disease and it transmits through airborne droplets. Airborne droplets are transmitted when an infected person coughs, sneezes, or talks. Droplets can spread to people up to 6 feet away. The transmission of the influenza is very similar to how COVID-19 is transmitted. And this picture here on the right is just showing how droplets in influenza or coronavirus can be transmitted. So some risk factors for the flu are adults that are older than age 65, residents of nursing homes and other long-term care facilities, people with weakened immune systems, so people with chronic illnesses such as asthma, heart disease, kidney or liver disease, or diabetes, and people with a BMI of 40 or higher. And getting the flu vaccine every year is the best way to decrease your chances of developing complications to the flu. Okay, I'll pass it back over to you, Andrew.
Thank you, Zara. So the onset of flu symptoms are often sudden and rapid and can include fever and chills, cough, sore throat, a runny or stuffy nose, fatigue. You'll probably feel body and muscle aches. Vomiting and diarrhea is mostly common in children, and adults with the flu don't tend to exhibit these symptoms. And influenza treatment. As Zara mentioned earlier, the vaccination is the most effective way of get yourself from getting the flu. Once you get the flu, there's really no real treatment for it. Most people with mild flu symptoms don't require medical treatment. If you get the flu, the most important thing is that you stay home, make sure you're avoiding contact with others, and you're covering your coughs and sneezes. If you're in public, make sure you're wearing a mask. You can take some medications to help treat the symptoms of the flu, like Tylenol for coughing, but besides that, it's mainly focused on preventing it from spreading to others. And I'll give this to Zara again.
Thank you, Andrew. So managing flu symptoms at home is really important. It's important to drink at least 8 cups of water a day and get at least 8 hours of sleep. This helps you recover faster, and use over-the-counter medication to treat aches, fever, or cough, so like Tylenol or ibuprofen. You can also use a humidifier or steam to relieve congestion. And I'll hand it to you, Chad.
Awesome. Thank you, Zara. Here, I'll go over the situations in which severe cases of the flu can arise. Typically, individuals with chronic medical conditions or those who struggle to manage flu symptoms are predisposed to developing potentially fatal complications. This typically occurs due to chronic inflammation from untreated flu symptoms. So here, worsening, some of the complications that can occur involve worsening of current medical conditions, pneumonia, myocarditis, and in severe situations, sepsis can occur. So in order to really prevent this situation from occurring, we suggest and recommend that individuals identify and address their symptoms as soon as possible to minimize any development of complicated flu. Next, we'll be going over the prevention interventions that we suggest to minimize transmission and contraction of the flu. Here we'll be covering the influenza vaccination, proper body and hand hygiene, putting on a face mask or donning a face mask, and social distancing. To the right, I have a graphic showing the chain of infection. Here it outlines the different points in which the flu and many other viral agents are transmitted from one to another. And so here we'll go over how the influenza vaccine is very useful in preventing flu contraction. It is actually the #1 method for preventing infection, as my fellow students have mentioned. The vaccine, for a simple outline of how it works, simply stimulates the body's immune defense, creating antibodies which are directed towards attacking the antigen, or which is also another word for the flu. So who should get the flu vaccine? We suggest, the CDC has collected evidence and suggests that everyone above the age of 6 months should receive their annual flu vaccine. This is typically done towards the winter season, as this is when flu is most prevalent. And there are some exceptions to individuals with allergies or certain medical conditions in which different vaccines or other substitutes can be provided. We have a link towards the bottom, which can be used to see which exceptions individuals may have. Next, I'll be going over the notable benefits of the flu vaccine. First off, the flu vaccine can help individuals minimize symptoms, and it helps minimize the number of infected individuals and the number of flu-related hospitalizations. It is a very strong first-line defense. As you can see in the graphic post on the right, we showed the different benefits the flu vaccine had in the 2019 to 2020 season. It prevented 7.5 million flu illnesses, 105,000 flu hospitalizations, 3.7 million influenza-associated hospital visits, and much more. Next, I'll be going over how to properly perform hand hygiene, or other words, washing your hands. There are simple 5 steps. First, the individual must wash their hand or wet their hands thoroughly with water and apply soap. The next step is to lather the hands thoroughly, the front and back, under your hand nails and between your fingers. It is suggested that the individual scrubs for a minimum of 20 seconds, which is also the length of the happy birthday song, which many individuals find helpful for washing their hands. And then lastly, they must rinse their hands thoroughly under clean water and dry with a hand towel or an air dryer if available. We also have an infographic on the right showing the steps as well. Next, I will pass it on to Janelle.
Thank you. Another precaution that we encourage individuals to take is to wear a face mask. Wearing a face mask properly over your nose and your mouth helps to prevent you from spreading the sickness that you might have and decreases the chances of you becoming infected with the sickness someone around you may have. And to our right, we have a video from the CDC on how to properly don your face mask.
Know how to wear your face mask correctly. First, wash your hands with soap and water for at least 20 seconds or use hand sanitizer that contains at least 60% alcohol. Put your face mask over your nose and mouth and secure it under your chin. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Make sure you can breathe easily. Remove your mask carefully. Untie the straps or unhook the loops from your ears and pull the mask away from your face without touching the front of your mask. Don't touch your eyes, nose, or mouth when taking off your mask. Wash your hands for at least 20 seconds immediately after removing your mask, or use hand sanitizer that contains at least 60% alcohol. Learn more at cdc.gov/coronavirus and coronavirus.gov.
Another precaution that we encourage individuals to take is to avoid touching their eyes, nose, and mouth. You would avoid touching your eyes, nose, and mouth to help prevent the spread of germs. And this occurs when your unsanitized hands come in contact with vulnerable areas of your body. So by avoiding touching your eyes, nose, and mouth, you can help prevent spreading infections. We also encourage you to cover your coughs and sneezes. To properly cover your coughs and sneezes, you would either cough into a tissue or sneeze into a tissue. You would dispose of that tissue and then you would sanitize your hands either by washing them or by using hand sanitizer. We also encourage you to social distance when necessary. So if you or if someone you know is infected with the flu, we would discourage you from coming into contact with those people during that time. And here are some additional resources and references if you are interested in learning more about the flu. And that is our presentation. Thank you.
Thank you.